Good morning, everybody. It's Dr. Brace here. Welcome to Facial Plastics Friday, today, February 4th. Instead of continuing with the facelift series I had planned today, it's World Cancer Day, so I thought I would take a little break and we would address cancer. The most common cancer in the human body is actually a basal cell carcinoma, which happens to be a skin cancer. And so in the world of skin cancer care, that's the most common thing that surgeons have to remove. And the most common site for a basal cell carcinoma is actually the head and neck skin. So as a facial plastic and reconstructive surgeon, I spend a lot of my time seeing people with basal cell carcinomas of their head and neck skin, removing them and repairing the defect or the distortion that the removal causes. Now, basal cell carcinomas, if you have to have a cancer, are probably the best one to get because they're cured with surgical excision. Sometimes we do radiate them if there are deep margins involved that are missed. Sometimes radiation is more appropriate for somebody who's frail and can't undergo surgery, but for the vast majority of patients, surgical excision will cure them. And then you're left with the problem of having a hole, usually in the face or the neck where the skin's been removed, that has to be repaired. And so every other Monday at Guelph General Hospital, I run a skin cancer clinic and I remove anywhere from 15 to 22 basal cell carcinomas primarily, but also sometimes squamous cell carcinomas and melanomas. In terms of order of how common they are, basal cell cancer makes up 80 to 85%. Squamous cell cancers are somewhere around 10% of the skin cancers we deal with. And then melanomas and other rare tumors are that last 5%. But primarily, when I'm doing skin cancer surgery, it's almost exclusively basal cell carcinoma. And so basal cell carcinomas tend to occur on the head and neck skin because that's where we get the most radiation exposure from the sun. And what you want to look for with a basal cell carcinoma is a little nodule, a little bump that often has a little central crater. It's sometimes called a rodent ulcer. It's kind of a gross description, but it looks like it's been chewed out in the center. It can be itchy. It can have a little scab on it, and they tend to appear and then just not go away. So if you ever get a sore on your head and neck skin that does not resolve in 3 weeks or so, it should be looked at by your doctor because you may have a little skin cancer there. And if it is a basal cell carcinoma, then it's good news because if you're going to get cancer, it's the best one to have. It's bad news because it means that you need to have it removed, which causes a lot of stress for people because they think it's going to distort their face, distort their identity. But one of the things I take pride in doing and pride in being a facial plastic surgeon is giving people the best outcome as possible. So reconstructing that defect so that they can go back to normal life and not be self-conscious about what it looks like. And so I'm going to show some pictures here of some basal cell carcinomas that I've removed and then what the repair will look like. And you can see that what a basal cell carcinoma looks like here in this little video. This is one on the nose. And this one, the options for repairing this would be a skin graft or a local or pediculed flap. It was a little bit too big for a local flap, it would cause some snarling of the nostril. So we discussed a little cheek flap versus a skin graft, and this gentleman preferred to have a skin graft. I don't have his post-op because I just did that the other day. But we can look at another example here of somebody with a basal cell on the tip of their nose, and you can see how with a forehead flap where we flip skin down from the head, you can reconstruct the nose and make it look really quite remarkably good. And with some laser treatments, you can fade those scars and the skin basically blends right in. I saw a lady yesterday, a sweet lady who had a very aggressive and very advanced basal cell carcinoma of her lower eyelid. This is what happens with basal cells. The reason why they're considered cancer is because they're locally invasive. They are slow growing. You don't have to panic and worry about having a basal cell removed as soon as it's diagnosed, but you do want to have it removed as soon as possible because if left for months and years, it can become invasive like this one here. It can absolutely destroy a local structure and encroach on things like your eye. And in those cases, you really do want to have it removed. So this sweet lady, we operated on yesterday and she gave permission to show pictures of her tumor here. And I had to remove whole eyelid and portion of her conjunctiva and repair it with grafts from inside her mouth, cartilage graft from her ear, and again, a forehead flap to cover the skin. And so everybody out there, if you ever get a spot that doesn't heal, that has a bit of itchiness, that can be bleeding or crusty and sometimes even painful, Don't ignore it. Have your family doctor see it. And if they're worried about basal cell carcinoma, they may biopsy it themselves or send you to dermatology or someone like myself to have it looked at or biopsied to make sure that you catch skin cancer early so that when you have to have it removed, it's a small excision and not something large that requires a big reconstruction. If you have any questions about skin cancer, send them my way. Everybody have a great weekend. Happy Facial Plastics Friday.